Market failure occurs when the market, through the price system, cannot obtain an optimal allocation of resources due to differences between private and social costs and benefits. This then results in a net social welfare loss, or deadweight loss, also known as a allocative inefficiency, meaning that there is a loss of economic efficiency. For our investigation, we'll be looking at the cigarette market. The cigarette market is a negative externality of consumption, as there are spillover costs to a third party from the consumption of the good.
Spillover costs. An example of a spillover cost is the effect on the third party, this being the hospitals using their resources to treat those that have developed symptoms and/or diseases from smoking cigarettes. Smoking causes 90% of all lung cancer deaths, whilst also causing 80% of chronic obstructive pulmonary disease deaths in the US, according to their government statistics. Smoking kills an estimate of 5,000 people a year in New Zealand through diseases such as cancer, heart disease, and strokes. According to statistics from the NZ Ministry of Health in 2007, there is a social and healthcare cost of roughly $1 to $1.6 billion spent on smoking-related illnesses. This data is showing us that the consumption of cigarettes is very harmful to the health of men and women in our country. The money, resources, and doctors use for the treatments and procedures for these patients with smoking-related diseases and illnesses could be used for other less avoidable or unpreventable diseases.
In its core, the term marginal benefit, MB, refers to what the consumers are willing to expend for them to acquire an additional unit of good, whereas the term marginal cost, MC, is the value of the good/service that is given in order to procure the additional unit. However, marginal social benefit, MSB, by definition is the total overall benefit consumers contribute to society from either producing or consuming a good or service. The marginal social cost, MSC, is an indication of the impact towards the economy that is caused by the production of an additional unit of a good/service. It is by definition the cost the society expends for the production of one more unit of the good or service.
Setup graph. Within the market for cigarettes, we are currently sitting at the price equilibrium and quantity equilibrium. Currently, the price equilibrium is sitting too low and the quantity equilibrium is sitting too high. This meaning the good is underpriced and the good is overconsumed. We want QE to sit at QS, this representing the socially desirable output, but currently is sitting at QE. This therefore causing a deadweight loss. This being shown as the black shaded area. To eliminate the deadweight loss, we want to get QS and shift the MB to the MSB curve. We want to apply government policy in attempts to negate the price and consumption of cigarettes. Policy 1. Imposing a tax on cigarettes. Within the market of cigarettes, we want to eliminate the deadweight loss and eliminate negative externalities, this being spillover costs onto third parties, i.e. hospital resources. This can be done by applying the government policy of the imposition of tax on cigarettes. The initial effect of increasing the price of cigarettes will be that the producers will have to supply less, and it has now become more expensive to produce the initial amount. Consumers are no longer purchasing the same amount of cigarettes as it has become too expensive for the consumers to afford. Referring back to the law of supply and demand, there will be lower consumption because of the increase in price. The marginal social benefit curve doesn't shift. This is because the tax on cigarettes affects the consumers and does not influence their taste of preference. Therefore, the utility from the unit of goods stays the same, but with the tax policy, they can no longer afford it. With the tax imposed, PE will increase from PE to P1, which is passed on to the consumers, i.e. the tax, whilst the rest is covered by the producers, shown by P2. Marginal benefit curve, MB, isn't shifted at all, rather the demand only moves up the curve. The marginal cost, MC, curve is directly affected by the tax policy, as because the government has issued a price increase on cigarettes, the MC curve is moved upwards and right to MSC-MC plus tax, as producers can no longer afford to produce the same amount as they did before the tax. This also shows how the demand shifts up the curve. This causes QE to shift to QS, moving towards a socially desirable output. Therefore, due to this shift, we can see on the graph that the deadweight loss is eliminated, and therefore there is no more market failure.
Policy 2. Education/advertising. By imposing this government policy, there will be an increase in anti-smoking advertising broadcasted online, on television, and in public places. This will cover the damages and effects of smoking on things such as health, family, well-being, and income. This will also invoke advertising quitline, a service in which smokers can call and get more information on the effects of smoking, ways to quit, and tracking your progress towards quitting. Education will also discourage the smokers and non-smokers on the effects of smoking. The introduction and advertising on substitutes of smoking such as e-cigarettes, vapes, nicotine patches, and gum. These provide a healthier alternative from smoking cigarettes and also aids to the progressiveness of someone quitting. With them being informed with this advertising and information on the effects and risks of smoking, we would expect to see a change in the consumer tastes and preferences for cigarettes. They will now be informed and aware of the hazards and substitutes for cigarettes, and with this, their social desirability output will decrease. This can be represented on the graph. PE, price equilibrium, stays the same as the marginal benefit curve, MB, shifts to the left from MB to MSB/MB as consumer preferences have changed. While consumers' desire for cigarettes decreasing, this causes QE to shift to the left from QE to QS, moving to the socially desirable output. As the curve has shifted to the left, the dead weight loss is eliminated, hence there is no more market failure. Discussion: equity and efficiency. Is the addition on taxation equitable?
The consumption of smoking has a very low elasticity and is labelled inelastic. This is due to smokers being addicted to the cigarettes, and therefore when the price increases due to tax, there is less than proportionate change in the consumption to the increase in price. They will therefore put a larger burden on those in lower income groups, as they are paying a large proportion of their incomes for cigarettes, whilst the higher income groups will continue paying a smaller amount of their income for cigarettes. This therefore puts a very large strain on the lower income groups and is seen as unfair.
What about the health costs that smokers have on the government healthcare?
In a study taken in 2007, smokers pay a larger proportion of tax than the net economic costs, and later in 2012, smokers were still paying a larger proportion of tax than the government paid out on healthcare for smokers. However, this is excluding the economic costs it has on the economy. As with smoking-related healthcare, there is a loss in productivity and efficiency in the markets.
How could taxation be made more equitable?
Taxation should be based off two main principles. The first principle being the benefit principle. This being the proportion of tax towards the consumer should be in proportion to the benefit they receive from government programs. For our context, it would be smokers receiving equivalent healthcare in proportion to the tax they pay on cigarettes. The other principle is the ability to pay principle. This is the amount of tax the consumers pay should be in proportion to their income and wealth. This is a lot harder to monitor as cigarette suppliers cannot calculate the income of each person that comes into their store.
Policy 2. Is the addition on education/advertising equitable?
As Policy 2 involves the advertising and education of the risk of smoking methods on quitting and substitutes, this may leave current smokers feeling discriminated against by the adverts and education itself, along with making non-smokers hold a stigma against smokers. This may leave a negative effect on smokers and may not cut back people from consuming cigarettes, and they may even consume more as a response to the advertising.
How could education/advertising be made more equitable?
To make advertising/education more equitable, we have to take into consideration some principles of advertising and education. We need to avoid any discriminatory factors towards smokers whilst also maximizing effectiveness of this policy. We aren't trying to incriminate smokers. This will also remove the potential stigma it could cause around smokers. Overall, for advertising, there needs to be guidelines and regulations to make it as effective and fair at the same time. Discussion. Efficiency. Policy 1. Is the addition on taxation efficient?
Tax itself is most efficient as it reaches the whole population of smokers, as their suppliers increase their prices, passing the tax on to the consumers. Instead of reaching a small section or sector of consumers, it reaches out to everybody, influencing their decision to continue smoking or not with the increased prices. Tax may not really affect the higher income earners as they can afford it. Lower income will probably be affected more, however this is an inelastic demand market for cigarettes as consumers are addicted. This can make these consumers irrational, and therefore they will instead cut back their costs on other goods and services to afford the same number of cigarettes, counteracting the tax policy. This therefore may result in a decrease in consumption, proportionally less to the increase in price. This will be an inevitable outcome, as there are very few ways to combat this in the current economy. So for this percentage of people who are addicted to smoking cigarettes, the consumption of cigarettes will be narrowly affected, which puts the efficiency of this policy to not be that useful towards those consumers.
How could taxation be made more efficient?
The government policy of issuing a tax for cigarettes can have improved efficiency if the tax percentage for the units of cigarettes were annually increased. Although the immediate effects would be the same as described before, over the long term the public will over time understand the trend of the increasing price of cigarettes and would eventually decrease their consumption due to affordability. After a few years of this policy, when the prices of cigarettes have been heavily modified by the tax, it would be almost unavoidable for the consumers to ignore the sizable price of the good until they are finally more or less willing to purchase a single unit of the good for the given price.
Policy 2. Is the addition on education/advertising efficient?
Advertising as a whole subject is a very efficient message of passing on a message about a product, event, and more. It is displayed in everyday places within cities and public places, especially online, influencing the subconscious and conscious views and tastes and preferences from the public and consumers. However, the main issue with the education/advertising policy is the high probability of the viewers ignoring it. We are a technological society, constantly using devices throughout our day-to-day lives. Through this advertisement policy will target devices as a medium to send its message on the risk of smoking. With this, most users of such technology will likely just scroll past the advertisements, making it a relatively weak policy in terms of efficiency. The other is that this policy may take years to take any major effect, costing a lot of money to the government with the short term, with the reduction of smoking taking a longer term to come into play.
How could education/advertising be made more efficient?
Advertising has a cost to it, unlike taxation, hence the government has to pay out for this government policy. This may cause for funding reduced from another project of the government. This proves a liability in the short term for the government and the economy. However, through the long term, this policy will predict to reduce the spillover costs, healthier households, and economic environment, e.g. workforce. Another issue is that the public lose interest very quickly. As in general, the public are not wanting to change their way of life over a simple advertisement. To maximize the efficiency of this policy, it should be relevant and be more interesting to the consumers of cigarettes to increase the chances of the consumers taking the advertising and education into consideration, changing the overall consumer preference towards smoking.
Conclusion. After weighing up the two policies, taxation is better as it has more impact on the people and affects all consumers of cigarettes, whilst advertising is subjective to the viewer and how it affects them. However, we will do education and advertising policy in the background of this because there is still effectiveness in using this policy in addition to the taxation policy. With the revenue gained from taxation, the government can put towards the advertising/education policy along with the healthcare. So it's a win-win situation on maximizing the goal of reaching maximum socially desirable output. Thank you.